Hello, welcome to all the participants. Here at the outset, I like to make you aware that this webinar is all about basic life support. We are sharing with you the latest guidelines 2015, which has been just updated a month back. So what is basic life support? Basic life support is something which is all basic. A person in need of medical help is there, but we don't have any specialized medical gadgets. No stethoscope, no blood pressure instruments, no oxygen, no medical help. What we have is our bare hands and our conscious mind. We need to apply our conscious mind to help this patient get some medical help, either to take him to a medical center or to get a hospital doctor to this patient. In doing so, the chances of survival, the outcome of survival would only be better. The outcome would be better if we go through the sequence, if we follow a sequence how to go about it. First thing, we need to check the responsiveness of a person who needs medical help. It might be, it might be possible that he has just a little headache, or it might be possible that he's become unconscious. The spectrum is huge. So if the person is just become unconscious, the trouble starts there. Because as we don't have any medical gadgets with us, it would be difficult to support him. But in the meantime, till the doctor arrives to him or we take him to a doctor, we can at least try to help him by giving him some help, which we will explain you further. So the first thing, we check the responsiveness. You ask him, are you all right? You check whether he's breathing or not. If he's speaking to you, means he's breathing. If he's not speaking to you, chances are that he is unconscious and not breathing. Next, when you understand that the situation is grave, that you need some more help than yours, you will alone not be able to help this person in need. You need to call somebody. Calling somebody can be a local physician, a general physician, a person whom you know, a doctor you might know, or a normal hospital helpline numbers. Indraprastha Apollo Hospital operates 1066 online number. It's a helpline number which runs 24/7. You can call up there, get some help. The next is the sequence which I wanted to make you aware of. The alphabetical structure is CAB. C for circulation, A for airway, B for breathing, and then comes D for defibrillation. What is the most important system in our body? We know we have a few systems. The one is the system where the blood flows throughout the body. It's called the circulatory system. There is another system, the airway, through which we breathe air from the atmosphere to the lungs. And there's breathing, the whole act of breathing, the lungs breathe, so we get oxygen from there. So now how to decide which one of this, the circulation or the breathing, which one is more important, which one to support first? Let me explain you this by saying the brain needs oxygen. The oxygen is at the lungs. So from the lungs to transport it to the brain, we need a system. The system is the circulatory system. So if we don't have a blood flow, even if we have 100% oxygen at the lungs, nothing reaches the brain and brain dies, the person dies. But if we have a blood flow and if we have 10% of oxygen in the lungs, still the brain would get 10% of oxygen and it will hold on. As explained, the circulatory system is the most important. And so we would start supporting the C first, C for circulation. On a daily basis, how do we check circulation? When you go to a doctor, he checks your pulse. He checks your pulse by putting the fingers on the wrist and he counts your pulse per minute. Pulse can be felt at several places in the body. The radian which I am talking about is at the wrist. One can even feel it at the elbow joint. One can even feel it at the neck region. As the blood pressure in the body decreases, the blood pressure starts to fall. The pulse also starts to get away from the peripheral regions. Uh, Explaining it is something like this. You have a water pump at home. If it has a good power, if it is a good motor pump, it will take the water to a higher level, maybe a fourth floor or a fifth floor. But if you have the water pump which does not have so much of power into it, it will not fetch the water so high. Here, if the blood pressure in the heart, in the body is less, it won't force the blood to go to the peripheries so much. So in the peripheries, the flow, you will feel the flow as less. And hence you will not be able to find the blood pressure at the, hence you would not find the pulse at the wrist or at the elbow joint. The only place where you find the pulse, even if the blood pressure is very low, even if the hands and feet are cold and clammy, is at the neck, because this place is the most closest to the heart. Even at small blood pressures, you can feel it. It's at the neck region, and the vessel is called a carotid vessel. So you put two fingers on your neck, slide it onto either side, and on any one of the side, you can feel the thumping pressure on your fingers. That's the carotids. In children, we do not check the carotids because these vessels are fragile. In children, we prefer checking it at the elbow joint, which is called the brachial. Carotid pulse should not be checked both sides at the same time because that's the only lifeline supply to the brain. We should only check one carotid, one side carotid, either the left or the right at one time. So, what are the possibilities when we are checking the pulse? There are only two possibilities. Either the pulse is there or the pulse is not there. If the pulse is there, means the blood is flowing in the body. But what if the pulse is not there? The problem is here. Means the oxygen is not going to the brain. We need to manually compress the heart, manually press the heart to get this oxygen from the lungs to travel to the brain. That is called compressions, CPR. In short form, it is known as CPR. It is compressing the heart. Now, as we all know, the heart lies in the center of the chest. It lies in the center of the chest. It is deviated a little to the left, but it is exactly in the center of the chest where our heart is. So we need to press in the center of the chest. How do we understand where would be the center of the chest? If we put two imaginary lines, one which would divide the body to two parts, the right and the left, and one between both the nipples. The point where it intersects is the point where we compress the heart. For compressing the heart, we need to again use only our hands. So we put two hands on the center of the chest, Stand straight onto the body and compress it for 30 times. Here is at the center of the chest, two hands, the elbows are straight and straight onto the person, and we press it for 30 times. When we press it for 30 times, we count it loudly. Example, 1, 2, 3, 4, 5, 6, 7. Why do we count it loudly? We count it loudly because of two reasons. Number one, we are sure that we have done 30 compressions. And number two, we would know whether we are doing it regular or we are irregular. If we count it 1, 2, 3, 4, 5, 6, this is regular. If we count it 1, 2, 3, 4, 5, 6, 7, 8, 9, we know that we are irregular and we can correct ourselves. After 30 compressions on the chest, at the rate of 100 to 120 per minute, the rate is almost faster than a second. Since I told you at the outset, we don't have any medical gadgets or even any electronic equipments, no watches to keep ourselves understand how much we are doing. We need to understand by doing it a little faster than a second. The count would be 1, 2, 3, 4, 5, 6, 7 till 30. How much chest do we press? We press it almost 2 inches. It's difficult to measure it by 2 inches, but it is putting the whole body weight onto the chest. After every chest compression, we should get back our hands to its normal position to let the chest recoil, let the heart recoil. And there shouldn't be any interruptions when we are doing compressions from 1 to 30. Once done up to 30, the C part gets over. Then comes alphabet A. What is A? A is an airway. As the name suggests, the airway, it is a way through which we breathe from atmospheric air to the lungs. The oxygen, the various mixture of gases goes from the atmospheric air to the lungs. In 99% of people who are unconscious, this airway gets obstructed by the tongue which falls back. Example, people who snore. Why do they snore? They snore because their tongue has fallen back, and every time he breathes, the air flutters at the back of the tongue. Once you just wake him up and he becomes better. Here, when the person becomes unconscious, the same thing takes place. The airway gets obstructed here. Here the airway gets obstructed and no air is going in, so no oxygen reaches the lungs and hence he gets deprived of oxygen. What do? We do a small maneuver called head tilt chin lift. How do we do it? We again use our two bare hands which have been gifted by God to us. One on the forehead, the palm on the forehead of one hand, and the other hand, the two fingers, we put it at the chin and just try to lift the chin. So while lifting the chin, the head gets tilted and hence the name head tilt chin lift. And as you see in the head tilt chin lift, the airway gets open. Here the airway gets open. So a head tilt chin lift, that's A, supporting the airway. After A comes B, B for breathing. In normal days, how do we know if someone is breathing or not? We see his chest movements. Sometimes we can see the abdominal movements. Here, since we are deprived of time and we should not waste lots of time, the initial assessment of talking to the patient, checking the responsiveness would give us an idea whether he's breathing or not. If he's breathing, well and good. If he's not, what to do? We need to give him breaths. How do we give him breaths? It's again a manual procedure of giving him breaths through the mouth. Means we need to make him breathe forcibly to make the oxygen get into the lungs and from there through the blood flow to the brain. How do we do it? We put our mouth onto the person's mouth, pinch the nose and blow into his lungs. When we blow the air into his lungs expands and again gets back to his normal position. Again we give the breaths, again his lungs expands and get back to his normal position. Twice we need to give the breath, that is 2 breaths at 1 second apart. So, after the breaths, we again go back and do 30 compressions. 30 compressions, 2 breaths. 30 compressions, 2 breaths. 30 compressions, 2 breaths. 30 compressions, 2 breaths. And 30 compressions, 2 breaths. It's 5 times of this, and that makes 1 cycle. We need to do it 5 times before going back and checking the responsiveness of the person whom we are trying to resuscitate. Now, if we have a person to help us, we can divide our roles. One can do 30 compressions, the other can do 2 breaths. One can do 30 compressions, the other can do 2 breaths. But we can only change our positions after 1 cycle. That is, after doing 30:2 for 5 times, we can change our position. That the person doing compressions can go on the breathing side and the breathing person can come and do compressions. This was when there was no blood flow, that means the circulation was 0 and the breathing was also not there. What if we found out that the person is having a blood flow, he's having a pulse, he's breathing. The only problem is that he's become unconscious. If a person is unconscious, but he has a pulse, he is breathing, we need to put the person in a recovery position. Why do we need to put a person in a recovery position? It is because people, when unconscious, they try to vomit. If they vomit, they would vomit it out and not take it into the lungs and do themselves more harm. So here, as you see, a person who is lying down needs to be turned on one of his sides so that if he vomits it out and does not aspirate into the lungs. And at the same time, it does not fall either on his face or on his back. The last on the alphabetical list was D. D is defibrillation. What do we understand about defibrillation? Defibrillation means sometimes when the heart is sinking, when the blood pressure is falling, the heart tends to work in an odd manner. It does not compress totally, it just fibrillates. In that condition, if we have a machine called automatic external defibrillator, it's called an AED, automatic external defibrillator. This machine is designed to be used by a non-medical person. It is only designed to understand the heart rhythm, only one heart rhythm, which is called a ventricular fibrillation, which needs to be shocked and reconverted to a normal heart rhythm. So this machine is connected to the person, and everything is told by the machine once we switch it on. So the first thing which happens is when we switch it on, it says attach pads. So we attach pad at two places. These places are mentioned on the pads itself. One should be on the right side beneath the collarbone. The second should be left side in the axilla region. Axilla region means our armpit. So two pads at two places. Next, the machine says analyze the rhythm. The machine itself analyzes the rhythm. If the machine understands that this rhythm is a ventricular fibrillation and it needs to shock it, it needs to convert it, it says shock advised. If it says shock advised, we need to make sure that nobody is touching the person, because this would shock that person too who would be in contact because of the electrical intensity. So everybody should be away and we press the shock button. But if the machine says shock not advised, we continue with our 30 compressions and 2 breaths. So if no shock advice, it's 30 is to 2, 30 is to 2, 30 is to 2, 30 is to 2, and 30 is to 2. Now, this is a small flow chart, shows how do we go about. As I explained you, it is first we see that the scene is safe. Scene is safe means there might be a person who had got into an accident. We need to see that here there's nothing harmful for us too. So once the scene is safe, we check the responsiveness of the person. Once we see the responsiveness of the person, we decide whether we need to call somebody for help. If we need to call somebody for help, we go ahead and call somebody to help us. Once there is somebody who can help us, we do CPR at 30 compressions and 2 breaths. If we have an AED, we connect the AED to the person and try to see the rhythm, and if necessary, give shots. Now, on this chart, you can see what's the difference between adult CPR, child CPR, and infant CPR. All CPR is almost the same. It's all 30 is to 2, except in children, if we have two persons to help, we can even do 15 compressions and 2 breaths. We can do 15 compressions and 2 breaths. But otherwise, the ratio is 30 is to 2, 30 is to 2. Then, if we have a small child, in an adult, we need to compress the heart by 2 inches, that is 5 centimeter. In a child, we can compress the heart up to 2 inches. While doing so, we can put all our body pressure onto the adult, while on the children, we can put a little less pressure. CPR in children is exactly the same way as we do it in adults. The ratio is, as I told you, it's 30 is to 2 if we have only one person. If there are 2 people involved, it can be 15 is to 2. The depth can be up to 2 inches. So, single rescuer 30 is to 2, 2 rescuers 15 is to 2. About the AED, if the child is above 8 years, we can use a normal adult AED. If the child is between 1 and 8 years, we use the pediatric paddles on the AED. But if the child is less than 1 year, we don't use the AED, but we in fact use the manual defibrillator. So, to summarize everything, basic life support, as I told you, is only involving two hands and a conscious mind. We need to check the responsiveness. We need to understand the situation. We need to call somebody for help. Till the time we do not call, we get stranded. Next, as we understand, the most important system in our body is the circulatory system. We check the pulse. If there is no pulse, we try to manually make the heart run for 30 times 30 compressions. Then we go on to A, which is airway. We do a maneuver called head tilt, chin lift, and make the airway, try to make the airway clear. Then we go on to B, B for breathing. Make two breaths, give two effective breaths so that the lungs expand, and again we give the next breath after 1 second. And the last of all, if we have an automated external defibrillator, we try to attach the defibrillator to the person and defibrillate if necessary. If you have any questions, we will be happy to answer it.